and welcome back to Talk with Tonya, powered by PECGNA program. In this episode, our surrogacy expert Tonya Canaday will be sharing with our clinical director Dr. Irada on the importance of psychological evaluation in surrogacy process.
So when people hear the word psychological evaluation, they instantly feel really nervous and scared. Can you explain to us what a psychological evaluation for third-party reproduction actually is and why it's a normal part of surrogacy processes?
Yeah, of course. People do feel nervous. Anybody would feel nervous, to hear the word psychological evaluations, right? But it instantly sounds like they are being judged, especially in the art field. Many people have already been through a lot emotionally and medically. So hearing the word psychological evaluation can feel very intimidating. And honestly, word choice play such a big role. I'm telling you because I'm someone that come from a different culture myself, like across different cultures. That terms can carry very different meanings. So it's not just about judging someone and finding something wrong. It's really about understanding the person, how they are doing, what they have been through, and making sure this path feels right and manageable for them. So, and once people feel understood in that way, they usually become much more ease with the process. So, what choice is the key? And you need to be very cultural competence to understand that. Like, for example, I came from Asian cultures. I can speak with it. When you use the word psychological evaluation, they shut down immediately. But instead, I use the word somewhere along the line of like helping you prepare and to protect your emotions and making sure that you are making an informed decisions. I try to avoid the word psychological self because of the stigma.
Makes perfect sense. And it's really kind of you to understand that the other side, the people that you are interviewing, do feel very nervous. And so that's so kind of you to be thoughtful about that.
Mm-hmm.
So if somebody's getting ready to go through an evaluation for the first time, can you explain what typically happens in a surrogacy psychological evaluation?
So there's the pre and post session, right? The pre-session is like once we get a referral, the clinician usually have to review the patient's file first, and to make sure that we review if they have any medical or mental health background, and then so that we can be prepared. And then the next step is to make sure that we go through an informed consent with the client to make sure that we explain what the evaluation is involved, the limit of confidentiality, and we giving them space to ask questions. That part is very important. Then we move into the clinical interview, and honestly, that's where the real work happens. Yes, sometimes we may have testing data, but a good psychologist does not reduce a person to the score. We look at them as the whole person. We ask, does this information actually fit the person sitting right in front of us? What is their story and how do they cope? Because test results are just one piece and people sometimes overlook that, right? The interview is where you need to really exercise your clinical skill and the study about their history and observation and develop a very meaningful understanding of who this person is and whether they are truly prepared for this process. At the end of the day, we are not just writing a report. We are making sure it is safe and thoughtful decision for everyone involved. Does that make sense?
It does. And the fact that you don't take every single individual piece of information they give you, that you're looking at the whole person to help them make sure they're making the right decision is a huge thing to understand.
Mm-hmm.
So I'm curious, can you tell me when a clinician does these evaluations, what are the key areas that they're assessing?
It's really depend on case by case, and as I tell you, it's really depending on who is sitting in front of you, right? Case conceptualization is a very important skill that a psychologist must have. First of all, you have to analyze that diverse background. Are we using the right tools? Who are we talking to? We really looking at a few core areas, but always in an integrated way. First is emotional stability and coping, how the person manages stress, especially in a process that can be unpredictable, and motivations, why they are entering a surrogacy, and whether the motivation is thoughtful and well grounded. We also look at their understanding of the process, because this is a long, complex journey, not a short-term decision. Support system is so important. It's another key piece. Who they have around them and whether they will have the support they need throughout the process. And then overall readiness, meaning does this truly fit their life, their environment, their current situation? So it's not just about checking boxes. It is about understanding whether this person is stable, supported, informed, and genuinely prepared. And I don't want to get in too much into clinical, but there are a lot to get into it. But that's basically the core of what we are looking at. We're trying to provide safe and supportive environment. The main challenges that me as a mental health professional facing is that a lot of times gestational carriers, they are afraid to tell the truth during the interview, but later on we would get the report bounced from the clinic or from the agency because they didn't tell us certain thing, and then we have to redo the evaluations just because they felt judged, they felt uncomfortable, and they want to be chosen. So we really have to exercise that skill to provide a safe environment for them to bring out their story and letting them know, having certain history is okay as long as I can see that you have a good self-awareness and have a help-seeking behavior that is appropriate from the appropriate person and professional.
Very nice. Yeah, that's really insightful. Thank you so much. So is there a way in the psychological evaluations that you can ensure that intended parents and surrogates fully understand the emotional and practical aspects of surrogacy?
Well, that's where the psychological evaluation came from, right? It's really going through the consent to make sure that they have a full understanding of what they are getting themselves into, and each type of evaluation is different. Like intended parents, they have to understand that the result is uncertainty, and that they still have to be respectful to the surrogate. And for the surrogate, they also have to understand that she can try her very best, but it's just the nature of the treatment that you may have reoccurring miscarriages. We have to talk about difficult topic before it happened to prepare. That's why, they recommend that intended parent and surrogate meet with a psychologist first. I'm not sure if did I answer your questions?
Yeah, absolutely. Absolutely.